This is Dr. Lauren Mell, University of California, San Diego, Department of Radiation Oncology. This is an instructional video on IMRT treatment planning and evaluation for the International IMRT Protocol. This is a patient who has been simulated for treatment for stage 2B cervical cancer. She has undergone target normal tissue delineation previously, and now we're looking at the setup for her treatment plan. She had a 5-field IMRT plan generated for her using a static field arrangement. In this case, the angles were here: 71 degrees, 182, 263, 299, and 355. With a split field used for the 5th field. We'll turn off this field arrangement right now. Other IMRT planning techniques that are allowed are volumetric modulated arc therapy or tomotherapy. For static field IMRT, you can use 5 to 9 fields. In this case, we used 15 MV photons for the treatment delivery. The prescription dose was 45 gray and 1.8 gray daily fractions. The first thing we'll do is look at the isodose distribution in color wash. And we'll turn on absolute dose. And generally what we want to see is nice conformality around the planning target volume. As we scroll and get closer to the prescription dose, we should see a fairly conformal treatment plan with respect to the PTV, which seems to be achieved here. And then we'll review for any hot spots that might be of concern here in the 115% range. There's a region out here that is probably not of great consequence. Mainly we want to make sure there's not any major hot spots sitting right on the rectal wall, which will receive high doses during brachytherapy. So this seems to be acceptable from a subjective point of view. Then we're going to evaluate the dose volume histograms. And in this case, we will be analyzing several structures: the bladder, the bowel, the bone marrow, the rectum, and the PTV. So according to the constraints of the protocol, we'll first look at the target coverage, which seems to be quite good in this case. The red DVH is the PTV. The first constraint is that the 99% prescription isodose should encompass more than 90% of the PTV. 90% of the PTV is represented here, and that's receiving 100% of the prescription dose. So that is met. Conversely, 99% of the PTV has to receive at least 90% of the prescription dose. It's receiving at least 96%, so that's fine. 97% of the target should receive at least 97% of the dose, which is true here. And no, less than 1% of the PTV should receive more than 115. The 115 is out here, and that's much less than 1%, so we're okay there. Less than 10% should receive more than 110% of the prescription dose, represented here, and we're fine at about 1% of the volume receiving more than 110. So this is adequate from a protocol standpoint. Looking at the normal tissue constraints, the bowel should receive a maximum less than 50 gray. Here it's right at 50 gray. In let's see, the V45 should be less than 250 cc's. We'll switch to absolute volume. The volume getting 45 gray or more is about 120 cc's, so we're fine with that, although the maximum dose is a little bit high, so the plan will have to be recreated to meet this constraint, at least. The rectal max should be less than 50 gray. Which it's 48 gray, so that's fine. And the bladder max should also be less than 50 gray, which it is. It's at 49 gray. So the last thing to check is the bone marrow constraints. The volume of the bone marrow receiving 10 gray or more should be less than 90%. Here it's at 83%, so that should be fine. And the volume receiving more than 20 gray should be less than 75%. Here it's at 64%, so that's fine. So this plan is almost acceptable, with the exception of the bowel max. So we'll ask the dosimetrist to achieve this constraint here, and then this plan should be good for this protocol.